Hi everyone, this is Dr. Alison DiBarto Goggin, and today we are talking about the yeast connection and how candida can affect your body. So when most people think of yeast, they're thinking of vaginal yeast infections or thrush that happens after taking an antibiotic, and what they don't necessarily realize is that yeast lives in our entire body. It's a normal organism that we have, but it needs to always be in balance. So some common triggers that we'll talk about is if you're feeling overwhelmed, if you're feeling chronically fatigued and nothing is helping, like you've taken all of the B vitamins, you've taken all of the nutritional patches, you're using all of the coffee and creams and nothing's working, because that means there's something underlying there. Another common issue is hormone imbalance and figuring out why the body's struggling with estrogen imbalances, and that's something we'll talk about as well. Many people have commonly small intestine bacterial overgrowth with this type of issue in candida. Many people have chronic yeast infections, chronic bladder infections, chronic IBS issues, and they're chasing the IBS instead of chasing the actual root cause of the problem, which is candida. So another one that I see commonly is eczema or acne, and people think, well, I'm chasing the gut or I'm chasing my liver to fix my eczema, and it's actually candida overgrowth. So there's a lot of different symptoms that you can look at and a lot of different quizzes that you can take, and I'll post a yeast questionnaire in the bottom in the comments so you can check it out and see if this applies to you. So all right, we talked about the survey. Another common thing is like brain fog is really common with yeast, ADD, ADHD. So it's just all of these symptoms we have to put together and really figure out where is this coming from, why is it happening. So there's a couple tests that we can do. The number one most common but really unofficial test is to do a spit test. So when you wake up in the morning, to get a clear glass of water, and before you brush your teeth, to spit into the water and see, does it float? Do little strings hang down? Does it sink? And that will tell you if you have some yeast overgrowth. That doesn't always mean that you have excess yeast, but it can be a sign. So the other way that we can test is through just symptoms and going through that questionnaire and seeing, well, all of these symptoms correlated. And then another way, which is my favorite way, which is the official way to test, is doing an organic acids test. So you pee in a cup and we send it off to the lab. I send the test directly to you from the lab, and then you send it directly to the lab and they will test it for you. But it will test all of these different markers to see what is the yeast putting out, how much, and is this the actual problem for you? So that way you don't have to go through cleanses and treatments and chase these symptoms. We can just test for it, which really takes a lot of time off. So candida is something that lives in our gut especially, and it literally can create holes in our body, if you will. So when we were talking about leaky gut and how that punches holes through our intestinal cells, that causes those autoimmune issues, the food sensitivities, the headaches, it makes us all very, very sick, and many people struggle with this issue. The first thing most people do is say, I'm going to do this candida diet, and I'm going to cut out all sugar, all alcohol, all caffeine. I'm basically just going to eat spinach, and they hate it, and they're miserable. Yeah, Patricia, hi, yuck. Like, we want to be able to eat food. And that helps for a little bit, but what people don't realize, and then when that first day you get back off the diet and you're like, I'm going to eat food again because I feel good, and the candida's gone, and you have a pizza and you fall apart. And the reason for that, and why did the candida come back so quickly, is that it actually will eat any undigested food. So it doesn't matter necessarily if you change your diet or if you don't change your diet, because if you're not breaking down your food, if you're not chewing properly, if your enzymes aren't working, then that candida is still going to eat all that undigested food, still wreak havoc on your body and cause all these issues. So we really have to come at this from a multifaceted way to make sure we do cleanse all of that candida from your body and get it back into balance. So balance is the key, and not going too crazy with foods or eliminating things or sacrificing your life to reduce a bacteria by 10%. So let me run through some bigger symptoms of candida too, which is bloating, cramping, gas, rectal itching is really common. Many people don't like to talk about it, but it comes up in almost all of my symptom questionnaires. So if that's an issue for you, we automatically think candida as well. Interstitial cystitis is really common for women, which is a chronic bladder issue. Many times it is candida, many times it's autoimmune, so we just have to figure that out. Menstrual irregularities, rashes, inability to concentrate, thrush in the mouth. So if you have to scrape your tongue to get that white coating off, that is not necessarily normal. And it's common, again, but it's not normal. So that's coming from that thrush overgrowth. Especially if you've been on antibiotics for a really long time or constantly. I'll tell you, I had strep about 5 years ago now, and I was miserable. I lost my voice. I got on antibiotics because we don't mess around with strep. And all of a sudden my tongue started burning. And it was like, you know, when you eat a sucker and you get that little cut in your tongue and it burns. I thought, well, maybe I just ate too many of those Breathe cough drops. But it started growing. And I had a hole, like as a crater in my tongue from the thrush. So I had to go back to urgent care and get a rinse to help clear out that candida. Well, if it's growing in one place in your body, like your mouth or your arms, it's growing everywhere. So I really needed to do a cleanse after that. And I'll tell you what I did and the steps that I take with my patients as well. So if you're taking antibiotics or have ever taken antibiotics or birth control, steroids, or you have diabetes or a really hard time getting sugars out of your diet, because sugar still does play a role. So does stress. Stress will increase your cortisol and suppress your ability to balance all of these microbiomes in your body. And it's just one of those things where you have to manage the entire body and look at it from all over. So candida is not a let's just heal the gut or let's just heal the hormones or let's just fix the diet. So what it does is really gross is candida will literally snot all over your body. So it eats up all the sugar and it eats up all this undigested food in your body, and then it creates really what we call like metabolites, snot, garbage. Essentially it's poop. And it just spreads it all over your body. So it coats the lining of your gut. Obviously it coats your mouth, it coats your skin. Your body cannot work. And so what that actually does is it suppresses your body's ability to make serotonin in your gut. So that's why it's causing these things like depression, anxiety, because our gut makes 80% of our neurotransmitters. Well, it can't do that if it's covered in candida snot. That's really gross, right? And it also interferes with the body's ability to store and create B vitamins. So you might be constantly taking B complexes and feeling a little bit better, or I use those B patches and they're amazing, but you're never storing it. You never get to go off of these things because your body can't manage it, because that candida is constantly suppressing everything your body does. It also is linked to hypothyroid, because it will mess with your body's ability to use and convert thyroid hormones. So again, you might be chasing your thyroid all day long. You might be taking those supplements or those oils and it's not working. So if something's ever not working, it's because you're chasing the wrong root cause. Patricia says, so after the test and then the remedy, how long before the symptoms go away? I think it depends on which route you're going, and it depends on how severe those issues are as well. So that's a really good question. So some people can do the doTERRA cleanse, which is what I recommend because it has that GX assist in it with the oregano and the thyme, and that is really great for flushing out candida. So some people start to feel better after those 30 days. Now the next step after that is I use a homeopathic kit, because if it doesn't get cleared out and we haven't fixed the digestion yet, we got to work on this on a different level. And that depends, and this isn't a great answer. I feel like an accountant or a lawyer. I don't know. It depends. it's something that I'm actually going through right now with the homeopathic cleanse, because I've done the doTERRA part and I will keep doing that. And as an adjunct to that therapy, I'm doing the homeopathic kit, and it is doing its job because I don't feel good. And I'm on week 2. So I would say somewhere around week 3 to week 4, you're going to start feeling a lot better because your body is just going to have it all out of its system. And then on the other side of that ends up being the restore. So when we strip the gut of candida and we're using that fiber and the glutamine to help clean the body and the gut so it can start healing, we have to give it the tools to heal. So you're not done when the program's done. You're done when your body can digest food and start healing and making its own hormones. So anywhere from 30 to 90 days would be a great goal to have, to know I'm going to do this program, whatever that looks like for you, and then work on healing the body, and you're going to start feeling really good. So we just got to follow through and make sure that the candida is the right root cause for you as well. So you might do a cleanse or a homeopathic program and nothing changes, which is, it happens. So what does that mean? It means you're chasing the wrong thing. And that's not bad, because detoxes are great for resetting the liver, the kidneys, the gut, and repopulating. So that way at least you have a good base to say, all right, I'm all cleansed out. A lot of your symptoms are going to go down, and then you're going to see what's left over. Is it just the headaches, or is it just the skin issues? What else can we work on? And those are going to be those root cause symptoms to help you figure out which system is left. So the other thing I wanted to bring up, especially about hormones, is that estrogen will feed the yeast to keep growing. So if we don't fix the hormones on that end as well, or you're constantly pouring in plastics, or red wine is a histamine and it also feeds estrogen, you're just kind of creating this battle with inside your body to figure out, well, I'm chasing the yeast, or I'm chasing the hormones, or I'm chasing the thyroid. We just have to know and work together to figure out what the root cause is. And that's why birth control pills contribute so much, or really any hormone pill can affect estrogen levels and then affect the yeast as well. So the key is balancing, and it's, our body still needs carbs, so please don't go carb free. It's not always necessary, because our brain needs that fuel. So my biggest programs for clearing out candida would be, number 1, the doTERRA 30-day program, because you're going to raise your nutrition levels with whole food nutrition, fruits and vegetables and capsules, good omegas, which so many supplement programs are missing, and antioxidants on top of the essential oils, which we know can support their immune system, support balancing of the natural flora in our body. Notice I'm using the words balancing and not treat or cure or heal. But what it will do is support all of those detox pathways, all of those cleansing pathways to start killing off the yeast. You're going to be using Terrazyme, which is a digestive enzyme, which is going to help your body break down food so the yeast doesn't have anything to eat. And that's good. That's starvation of that yeast. And that's where those bad symptoms start coming in, where the Herx reactions, where, what do people call it? Like the healing crisis, if you will, where, okay, I'm clearing everything out. Now my headaches are really bad, or my stomach really hurts. And you just kind of have to push to that other side. And there's tools to manage that. And I don't really necessarily always go through that. It just depends, of course, my famous answer, and how bad the symptoms are. So Patricia says, so this sounds really serious. How many symptoms would I need to see before I get tested? Girl, you're answering all these I don't know questions, which is great, because I would recommend starting with the Candida questionnaire, which I'll post in the comments below when we're done here. So that way you can just start checking off these symptoms. And if you come back, and the ones I have a checklist. If 5 or more, or like 5 or less, you probably don't have a candida issue, or 10 or more is a maybe, or like 20 or more is a definite yes. And that way I would start there and say, if you're in that higher end, I would do testing for sure and make sure that nothing else is going on and mimicking. And then of course I would say, come get a functional medicine evaluation and see where this is actually coming from. So that way I can look at all of your symptoms all at once, all of the blood work you've ever had done, and say, well, candida looks probable, but let's make sure this is cleared up as well. And the rule with these types of infections is that one thing is never just one thing. And what that means is we can chase candida, but it could also be Epstein-Barr. And a lot of times when you have Epstein-Barr hanging out with you, which is mono, you also have other viruses like strep living in your body. So we have this navigate this, I call it the bus. Something's always driving the bus. We have to figure out what's driving it and what's hopping on in the back. Like your liver is tanking, or your immune system is yelling out for help, or your adrenals are taking a nap in the back on the hammock. We just have to figure out what that is and then get tested for it. Or like that organic acids test has testing for nutrition. So it tests all of your vitamins. It looks at yeast markers. It looks at bacterial markers. I catch many people who have C. diff or very serious bacterial infections that are underlying, that are causing the interstitial cystitis or chronic strep reactions. And then once we clear out the C. diff, then we can work on the yeast. So let's do, for everyone that's watching this or watching the replay, fill out that candida questionnaire and see what it comes back with, and see if your symptoms are related to candida. And then you have a good starting point. Then you know too, it's not all in your head, that it's not just anxiety or you just need to lose weight. It's that there's something deeper going on in the body. And then after that doTERRA program, you should be good to go. 9 out of 10 times, people get really, really balanced and cleared out. I have had just a handful of people need to go through this 2 or 3 times just to reset the whole body, because their body was so deep-seated after all of their hormone trauma, pregnancies, birth control, things like that, that the yeast just got so deep-seated, it just got too angry, and we just have to do one step at a time. And then do the homeopathic cleanse and just clear everything out. And after that, and what that homeopathic looks like is it's vials of liquid, which sounds ridiculous, but it's amazing and it works fantastically. And you take 1 vial every 3 days for 2 months. It's super simple. And that way is clearing out different levels of that candida. And then once you're done, you're done. And you don't have to worry about it anymore. That doesn't mean go out and drink 8 bottles of wine and order all the pizzas and go crazy at Dairy Queen. It still need that balance so you don't upset your body and cause, open that door for more issues. But those potencies of the homeopathics will really just help clear out anything that's left. And that way it's gentle. You're not going to be sick. You can still go to work and leave the house. And that's what I love about the doTERRA and GX Assist and these homeopathics, because they work so well together that you can still live your life and not be sick while you're going through the cleanse. Let your body heal and then move on with your life. So if you would like to figure out where these issues are coming from, I would be honored to be able to help you with that. So shoot me a message here on Facebook and say, hey, I want to do a 30-minute call with you. I always offer a complimentary call to make sure I'm the right place for you, to make sure we don't need additional testing before we get started and start digging into your health history and finding out all these things and putting together this big picture package for you and really getting to that root cause so you can get back to your life, start living happily and healthy again. So I would love to be able to talk to you about your symptoms, your issues, where they're coming from, and work on that game plan for you. So I hope this was helpful for you, gave you some ideas of symptoms, how to go about treating them. It can be very, very, very simple. And in the end, you don't have to starve yourself. You don't have to be scared that I'm going to make you go vegan and cut out all your favorite foods, maybe just a few, because you'll see the difference. But one thing at a time, one step at a time, and we'll get you to the other side together. All right, thanks everyone. Enjoy the rest of your evening, and next Tuesday at 1:30, barring any internet issues, since I can't connect to my office, I will be here, and we're going to be talking about cholesterol and everything you need to know about having some good numbers and healthy life. All right, thanks everyone.